Hello everyone, welcome to my channel. I am Dr. Siddharth, orthopedic surgeon. Today we are going to talk about the most common cause of back pain, joint pain and your muscle fatigue that I almost see every day in my clinic. It is vitamin D deficiency. Yes. You might be thinking, I live in a sunny place, I eat very good food. How will I become vitamin deficient? But the fact is, the hard truth is 80 to 90% of people in India are suffering from vitamin D deficiency without even knowing that it's affecting their joints, muscles, and bones. So let's take a deeper dive and see what vitamin does to our body. Let's start with the basics. What is vitamin D? Vitamin D is also known as sunshine vitamin because it is produced with the help of sunlight, but nowadays it is called a prohormone because it is synthesized by the body itself. What does the vitamin D do? Vitamin D helps you to absorb calcium from your gut. Vitamin D also helps to maintain your healthy bones and muscles. It also regulates your immune and nervous system. So vitamin D is very essential for your normal functioning of your body. Your skin produces vitamin D when the ultraviolet B rays, UVB rays from the sunlight comes in contact with your skin. The skin, along with the help of cholesterol, produces vitamin D. Hence, it is regarded as a hormone nowadays rather than a vitamin. There are other good sources of vitamin D in terms of food. Food like your salmon, egg yolk, fortified milk, mushrooms, cheese contains vitamin D. But they provide only 10 to 20% of your vitamin D requirements. So food is not the only source of vitamin D. The main source of vitamin D is sunlight. Your body produces it with the help of sunlight. So what are the symptoms of vitamin D? The symptoms of vitamin D includes low backache, joint pains, muscle cramps, fatigue, sleep disturbances, hair fall, even your mood disturbances. Since vitamin D is a hormone, it is required for most of the functioning of your body, and the deficiency of vitamin D leads to a lot of symptoms. I have had many patients in my clinic who underwent massage, unnecessary scans, treatments, painkillers without any use because the cause for the pain is going to be vitamin D deficiency, which is plain and simple, and correcting vitamin D could lead to very good improvement in your symptoms. So what does the vitamin D do to your bones, muscles and joints? In bones, vitamin D helps in absorption of calcium from your gut and deposit it in bones, failure of which will lead to rickets in children and osteomalacia in adults. In muscles, it can cause muscle fiber weakness, especially the type 2 fast twitch fibers, which can lead to cramps and muscle fatigue, which leads to fall and other postural issues. In joints, it can worsen the already arthritic joints, especially in patients with immunological conditions like rheumatoid arthritis, osteoarthritis. In fact, it's a silent stressor, weakening the foundation while we try to treat the surface. A study in the Journal of Clinical Rheumatology shows that 93% of people who had back pain and joint pains were suffering from vitamin D deficiency. In another study, it shows that people with back pain, joint pains, when supplemented with vitamin D for 6 to 8 weeks, had 50% reduction in their symptoms. Even in inflammatory arthritis and autoimmune arthritis, it is ideal to maintain your vitamin D3 above 30 nanogram per milliliter to prevent the flare-ups and inflammatory flare-ups of arthritis. So vitamin D is not a miracle drug, it is not a magic drug, but yes, it is very essential for the normal functioning of your body, and hence it is ideal to maintain your vitamin D3 level in the normal range. Who are the people who could be affected and who needs testing? People with chronic back pain, joint pain, people with muscle cramps, fatigue, individuals with osteoporosis, osteopenia, elderly people, people those who spend their time, most of the time indoors, people who use a lot of sunscreen, and even dark skinned people needs to get themselves tested because dark skinned people have a lesser tendency to produce vitamin D3 with the help of sunlight. And people those who are obese also should test your vitamin D3 because the vitamin D3 could get trapped under their fat tissue because it's a fat soluble vitamin. A simple blood test could reveal your vitamin D3 status. After testing, if your blood levels of vitamin D are low, you definitely require treatment. The normal range is between 30 nanogram per milliliter to 100 nanogram per milliliter. So anything below 30, above 20 and below 30 is called insufficiency, which should be addressed with, which can be addressed with diet modifications, more exposure to sunlight, some exercise, and all those things. Anything below 20 is a deficiency of vitamin D, which requires serious attention, and people might need supplementation for the same. The supplements are prescribed usually at 60,000 international units per week for 6 to 8 weeks, followed by 60,000 international units per month for 3 to 6 months. Sometimes calcium is also supplemented if the patients are prone to have osteopenia or osteoporosis. Morning sunlight between 7 a.m. and 10 a.m. could give you enough vitamin D3 if you are exposed for at least 20 to 30 minutes a day for 5 days a week. Like any other vitamin, too much of anything is good for nothing. Vitamin D can cause toxicity if taken in more than required quantity. So always consult your doctor before starting vitamin D3. When the vitamin D levels goes beyond 100 nanogram per milliliter, it leads to toxic symptoms. The toxic symptoms include nausea, vomiting, frequent urination, excessive thirst, confusion, irritability, and sometimes it leads to a lot of calcium absorption and deposition in your kidneys, leading to kidney stones and kidney failure. And very rare cases, it can even cause your heart rhythm disturbances. So always remember, more is not the best, balance is the key. Please do consult your doctor before you start on any vitamin D supplements because it could be harmful to you. So to sum up, vitamin D is a hormone which is required for many functions in your body, deficiency of which could lead to a lot of muscle pain, bone pain, and fatigue. If you're struggling with muscle pain, back pain, or fatigue, please do consult your doctor and get your vitamin D levels checked. It could be the key to your recovery. So, thank you for watching. If you like the video, please share it with your friends and family, and do leave your comments on what other topic you would like to discuss, and I will do it for you. Thank you. Stay happy, stay healthy. See you then. Bye.